Hi, Mary Lee.
Hello, how are you?
I'm good. My name is Gabriel. I'm an occupational therapy student at Nashville State Community College. And today I'm just going to run through the scenario that you have, which is a below knee amputation on your right side. All right? So, with that below knee amputation, it basically you had a transtibula fibula amputation. So, basically, what that means, just slightly below the knee, right between your shin muscles, right there got amputated. Okay? So basically, you use a sliding board for transfers. So you are a max of two. And being max, that means that I help you 75%. All right. So my goal with you is to get you to become independent with slide board transfers, as well as transferring into the wheelchair, transferring to a shower bench, and also giving you some community resources and working on some upper extremity strengthening. Does that sound good to you?
Yes.
Perfect. And while you're in the hospital, basically you expect to stay a week in this hospital, okay?
Okay.
So basically while I'm with you, we're gonna be seeing each other from either three times a week or the whole 5 weeks.
Okay.
5 days, all right?
Okay.
So basically what we're gonna do, my first day, I wanna work on just client education, making sure you know how to maneuver around the house, especially with a wheelchair,
Okay.
seeing how if there's any home modification we can do. For example, getting you a ramp towards your apartment or towards your house. Okay.
Okay.
Another thing we're going to work on. Basically, I want to work on this having pressure relief techniques. So basically, when you're on a wheelchair, we don't want you to stay in there and get those sores. So
Okay.
those pressure sores. Okay. The next day after that, I do want to encourage like successful transfers. Okay.
Okay.
So I want to work on slide board transfers from bed to wheelchair. Okay. And from bed to wheelchair, I also want to work on that upper extremity strengthening. All right.
Okay.
And while I have you here, you have any questions for me so far?
When can I go to work?
When you can go back to work?
Mm-hmm.
So that really depends on your discharge process and your healing process of your wound. All right. So for example, I can't give you an exact day when you're gonna be healed. Usually wound care takes between 2 weeks to 6 weeks. All right. While you're in the hospital, my main goal is basically get you strengthened and avoid that contraction in the knee area. Okay.
Okay.
So going back to work, that'll be basically a whole different ballgame. That depends on what your inpatient rehab says. All right.
Okay.
So my goal is to get you to inpatient rehab since you are relatively young. So I feel like you can handle 3 hours of therapy. Okay.
Okay. So after 1 week with me,
Mm-hmm.
then what do I do from there? Is somebody gonna?
So yes, after 1 week in this hospital, basically you'll be discharged to inpatient rehab where you'll spend 1 week over there, but you have more therapy.
Okay.
So, and after the inpatient rehab, depending how it goes, they can either send you to an outpatient where you'll go there for 30 minutes,
Okay.
or they'll send you to home health. So basically you can just come home and somebody comes and checks on you.
Okay.
All right. And while we're at it, main thing I want to focus on is your lower body bathing. So basically we'll use like a long handle sponge, something to promote that independence. All right. And prevent that like infection going into the wound.
Okay.
All right. That'll be my main goal. And probably in inpatient rehab, they'll be working on more of your IADLs.
What's that?
So IDLs are instrumental activities of daily living.
Okay.
So that's paying your bills, opening a door,
Okay.
stuff that basically you need to like just take care of yourself and others. All right.
Okay.
While you're in the acute setting, we're going to work on ADLs, activities of daily living. So that's your basic needs of life: bathing, grooming, dressing. All right.
Okay.
And of course, yeah, my goal for you, for the level of assistance that I want you to be before you leave here, I want you to be at least modified independence. So basically what that means, it is basically you're independent, but with the help of an instrument.
Okay.
So whether it be while you're in the wheelchair and you want to reach over for something, you can use a reacher for it. All right.
Okay.
Or while you want to take a shower, right, or a sponge bath, you're using a bench, like a tub bench or a shower bench. Okay. Just something that can promote that independence. Okay.
I appreciate that.
You're welcome. You're welcome. All right. And any other questions you have for me so far?
No, I appreciate it. That's almost everything you're talking to me about is what I've been needing.
Perfect.
So thank you so much.
Yes, ma'am. Also, more education on that amputation. I do have like community resources and other stuff you're going to be going through, like other healthcare services. Like you'll also be seeing a physical therapist, and also you'll be seeing a psychologist too, because like they say, losing a limb is the same as losing a family member. So that does affect people mentally and physically. You know what I'm saying? As well as we do want to combat that phantom pain. So right now, since you had that amputation, as you stand up, mentally you'll be feeling like your leg is there, which is not, and then that can result in a fall. All right? Speaking of falls, a couple precautions we have while you're going to be in here. You are a fall risk. So we're going to always be monitoring, like, if we ever try to work on stand or work on the slide board, just be aware of, like, that fall prevention. Okay. All right? Any other questions you have for me?
Thank you so much.
No problem, no problem. All right. So once again, I have this home exercise program for you. So yeah, every time we come to see you, either PT or OT, we're just gonna go over like those leg exercises, body positioning when you're sleeping, things this to keep that leg extended out. All right. So that way we can like speed up the healing process as well as make sure it heals right. Okay. We want to prevent like infections. We want to prevent like bed sores, and we most definitely want to prevent that muscle weakness in the upper extremities. Okay.
Okay.
And I answer your questions about work. Do you have any questions about driving? Because I do know you tend to drive a lot.
Yeah, I do.
Yeah. So one good community resource I also added to your home exercise program is the number to this company called Mobility Works. And what Mobility Works do, I went to go and visit them. What they do, they will modify your car to make it more to make it more easier for you to drive. For example, some people they'll put the handle or the driving pedal on the left side, or if that doesn't feel comfortable, they'll make it like a switch that you can use. All right.
Thank you so much.
Yes, ma'am. Anything else? Because I do realize that you do tend to have like your kids come and visit you. So you have somebody checking on you every day?
Yes, they do.
Yeah, so for the first few days, like once you like get to that outpatient or home health setting, just make sure you get your sons to come visit you. You know, come check up on you.
And they also have access to my security thing. So they monitor me.
Good.
All that.
Yeah, we just want to make sure you're being monitored and feel secure. Once again, I do want to promote that independence, but at any moment, if you feel like, hey, maybe I shouldn't be doing this, hit them up, give them a call, all right?
Okay.
Appreciate it. Yes, ma'am. Any other questions you have?
No, sir. Thank you so much.
Yes, ma'am. And just to reiterate, once again, while you're in here, we're going to work on that education. We're going to work on safe transfers, as well as we're going to work on some body positioning techniques, okay?
Okay.
All right. You have a beautiful one.
Thank you so much, sir. I appreciate you.
You are welcome. Bye-bye.
Bye.